Different outpatient physios use different treatments for the same minor injuries. There will always be some differences. Everyone is different, every physio is different, every patient is different, and no two injuries are exactly the same. So we will always have some variety in our physio treatments. The physio always individualizes the treatment for that patient on that particular day. Where the treatment difference becomes most noticeable and most problematic are with the outpatient physio treatments of minor injuries. What I am calling a minor injury here is that 20% of physio population that I talked about in a previous video. Some outpatient care is obvious, objective, and indisputable. This is post-op care, this is fracture care, this is the bread and butter clinic therapy. This is the 80% majority of physio patients. The problem I'm talking about in this video comes with the minority, that 20%. This is that murky gray area where things are not so clear. These patients have no specific history, they have no significant loss of range of motion or strength, they have complaints of pain but an unclear functional deficits. The diagnosis is vague or complicated, the prognosis is unclear, they've probably had this for a long time, they've probably seen different professionals without some clear success. These are the patients I call chasing butterflies. These are patients that get a mixed bag of treatments. This is the problem I want to talk about today. These different physio treatments come from three things. There's physio differences, there's patient differences, and there's differences in resources. First, for physio differences, I'm referring to differences in training and experience and preference. These physio differences come down to different schools of thought within the physio world and the different experiences that people have as physios. There are different schools of thought within physio. For example, Shirley Sarman is at the University of Washington in St. Louis. Stanley Paris is at University of St. Augustine in Florida. If you go to those schools and you learn according to those teachers. Post-secondary courses are a significant influence on physios. This is where I learned about Mackenzie and Cyriax and Mulligan. Each has their place, but my mix of these courses and my other courses is unique to me. My last example here comes from looking at the different sections of the American Physical Therapy Association, the APTA. There are 18 different sections like sports and geriatrics and private practice, plus each state has their own APTA chapter. This is another example of how all of physio gets sliced into little pieces. There are also differences in experiences as a physiotherapist. We're all different. We all have some mix of the big 5 personality traits: openness, conscientiousness, extroversion, agreeableness, and neuroticism. One study shows that physios tend to be more conscientious, meaning that they are more likely to be organized, disciplined, and achievement-oriented. They're more likely to be extroverted, suggesting they are outgoing, talkative, and energetic. And we're more agreeable, meaning we're more likely to be compassionate, trusting, and cooperative. New grads differ from experienced physios, and 5 years of physio experience is different from 20 years of physio experience. As a physio, we all talked about evidence-based practice, but as a working physio, we talked about productivity and billable hours. My last example of different physio experiences is David Nichols. In his book, The End of Physiotherapy, he advocates for a less rigid regulation of the physiotherapy profession. But that sounds pretty wild. The second source of differences comes from the patient. Different patients need different treatments. We need to tailor our treatments to the patient in front of us, and there are always some underlying commonalities. 2 arms, 2 legs, head on top. They may have less, but they shouldn't have more. Science says we live in objective, persistent external reality. This lets us make predictions and rules about the world. So we can listen to our patients, but we still need to treat our patients to the best of our ability. Sometimes patients want unreasonable things. Anyone who interacts with the public knows this. The problem here is that being an outpatient, our patient is a consumer, and they can go someplace else. They can go to different physios offering different treatments. They can go to non-physios offering different treatments. I call this the outpatient consumer marketplace of non-traumatic care. Patients tend to go looking for that quick fix. And I don't have a good solution for this. But like I said, we need to tailor our treatments to the patient in front of us, and we need to do the best we can with our abilities for patient care. The third source of different treatments is the difference in resources. Not every clinic has every modality machine. Not every insurance covers every treatment. I worked at one clinic with a shockwave therapy machine. Sometimes we would get a physio patient from other clinics just to do that shockwave treatment. Then the patient would go back to the primary physio for the rest of their treatment. Time can be a limited resource in determining your treatment elements. I know some clinics advertise 45 minutes or 60 minutes of one-on-one physio care. Every place has its limitations. The three big problems with these treatment differences are: 1. Using inferior passive approach versus a superior active approach. 2. A lack of evidence-based practice. And 3. Brand confusion. The first problem is our overemphasis on the passive feel-good modalities. This includes manual therapy. Teaching patients active exercises should always be our first choice. I agree modalities and manual care has some role in physiotherapy, but it's too easy to use modalities and manual therapy as an extra billable unit, and this is fraudulent care to improve revenue. I don't think we should do this. The second problem is a lack of evidence-based practice. This is a big part of the success of modern medicine, is that it keeps people alive. Emergency rooms have protocols to keep patients alive, and that's a great metric. By contrast, outpatient physio is chasing patient happiness as a metric. This is especially true for this 20% of physio patients that with their minor injuries that I've been talking about. This is a patient population that's hard to study. Diagnosis isn't always consistent, and the treatment isn't always consistent. Take something like tennis elbow. The diagnosis isn't controversial, but the treatment is controversial. These three reviews don't agree on the best treatment of care. There's this guy, and then there's this guy. This physio research isn't funded well because nobody's dying of tennis elbow. So we need evidence that this isn't always available. The third problem with these treatment differences is that it contributes to brand confusion in physiotherapy. We haven't clearly defined who should see a physio and which problems we should treat. Some people say we should treat everyone for everything all the time, but I don't have time for that. Post-op patients, fracture patients, those are the guys I want to see. Patients with pain but no trauma, full range of motion, full strength, well, that's the 20% of my chasing butterfly patient population. I hear people complain that one physio did one thing and another physio did another thing. Seeing an outpatient physio is kind of a lottery. Some are good, some are bad, some are experienced, some are new. Some are helpful, some not so much. A lot of musculoskeletal problems get better if you just stop irritating the underlying problem. So don't make things worse and emphasize pain-free exercise use, pain-free activity. What do you think? Do you like my stories? My neighbor cured his restless leg syndrome by putting a bar of soap in his sock. Was that a placebo or genius? I'm happy that he's better, and that's why we're doing all this, to make people better. What miracle treatments do you swear by? Let us know in the comments below. My 2 books are now available at Amazon. What They Don't Teach You About Documentation in Physiotherapy School, a short how-to manual for successful daily note templates, and From Injury to Recovery Through Exercise, simple functional exercise progressions for physiotherapists to restore lifting, standing, walking. Thank you for your support. Watch another video now or subscribe for the latest updates. Thank you.